For more than 1 month now, doctors in public hospitals countrywide have been on strike demanding a 300% pay hike per the 2013 collective bargaining agreement with the government. And the entire debate took a new dimension today after the doctors shattered what would have been a ray of hope for patients by declining the 40% increment promised by the highest office in the land, the office of the president.
We had very high hopes that the Executive Council of the Doctors Union would adopt this offer as we consider it as an offer that we have placed doctors in the right scale of the government remuneration structure, which is very competitive.
And so, acting out of a possible point of desperation, the government has announced plans to vote with higher willing doctors to take charge.
We shall be unveiling the strategy to be able to restore services in the country as we meet with the county leadership on Monday, and that will include engaging all service providers within the country, be they faith-based organizations, private institutions, and any other facilities which can be accessed by our citizens to be able to extend services to the level which they give. I want to underscore the fact that this will not be adequate, but we shall be able to know that given what the doctors have done today, that services do resume.
In a joint briefing at the National Treasury between Cabinet Secretaries Henry Rotich and Dr. Cleopa Mailu, the government stated categorically that the 2013 CBA the doctors want implemented in total was unimplementable, and as such, and demanded that the doctors either take the 40% government offer or negotiate a new workable agreement.
Without engagement of the county governments which employ doctors, no CBA can see the light of the day before the court, because those are the employers. And that is what we have been asking the doctors to agree to, so that we bring all the employers of the doctors around the table to be able to negotiate a new CBA which can be implementable.
The development comes even as striking doctors stand to lose their December salary unless they report back to work.
If you have not been working, you do not deserve to be paid. There are 48 employers in this respect, and each employer will take the necessary steps according to the law and the employment rules and regulation.
For now, it's fingers crossed for the nation, as it remains to be seen whether indeed the government will hire new medics or the doctors will hear the cry of the poor and get back to work.